So we want to start our meeting this evening, first of all, by acknowledging that we are on the ancestral lands of the Ohlone people, and we pay respect to their elders, past and present, and we give thanks to their sacrifice and examples of humility, stewardship, and resilience. So with that, we'll jump right into the review of our agenda this evening. So we're going to start off with a few updates that we have for the task force. We'll have just a brief overview of the draft recommendation process, talking about how we got to where we are this evening. And then we're very excited that we have chairs and co-chairs from each of the committees who will be presenting on their committee's draft recommendations, as well as the allocated budgets. And then after that presentation, we'll set aside a significant amount of time for task force discussion and answer any questions that anyone has. And then we'll end the meeting, as always, with public comment, review of next steps. So next slide. So next slide, we have a few updates to share with everyone. First, regarding our Promotores program, we're really excited that the city has been able to award contracts to 3 different community-based organizations. And as a result, we have 21 promotores on board. They have been onboarded, they have been trained, and they are in our neighborhoods working. So we're really excited about that. They started, I believe, back at the end of August. Many of them actually helped get the word out about our community resource fair, and they were also instrumental in getting the word out about the city's job expo that was held last month. So excited to share that update. Staff is scheduled to give an update on the Recovery Task Force work at the City Council's Community and Economic Development Committee, scheduled for Monday, October 24th. That meeting starts at 1:30. It's a hybrid meeting, so you can participate in person or via Zoom. And just a reminder, it's hard to believe that our task force process is coming to an end. A reminder, our next meeting, which is our last meeting, is scheduled for November 10th. So with that, we'll open it up to see if any task force members have announcements to share with the group. If you could just raise your hand, I see Frederick's hand immediately.
Hi, thank you. Hi, I'm Frederick from the San Jose Museum of Art. We want to invite everyone to our upcoming Community Day, Dia de los Muertos, happening on Saturday, October 29th, from 11 a.m. to 4 p.m. It'll be a full day of live entertainment, cultural demonstration, and an eclectic mix of art-making experiences. And join us as we collaborate with local artists, partners, and organizations for a truly intercultural and multi-generational event. So, thank you.
Great. Thank you so much, Frederick. That sounds like a lot of fun. Thank you for sharing with everyone. Anyone else? I don't think I see any other hands.
Hi, Rosalind.
Oh, yes.
Can you hear me?
Yes, we can.
My camera is a little bit wonky today, but I'd like to share that Public Health is holding a resource fair at our Story Road location. That's at Story and King. And it's just a health fair for the community. There will be also many other services provided. Also, I believe COVID vaccine, monkeypox vaccine, and testing will also be provided, and it's tomorrow. I don't have the exact time, but I would like to send out the flyer to the group, if that's okay.
Yeah, thank you so much for sharing. If you can email the flyer to the task. Oh, you want to email it directly to Carlos? And okay, that would be great. And we'll make sure that we get that distributed as soon as possible. If you could email it this evening, that would be great. We'll get it out as soon as possible.
Okay, thank you.
Thank you. Thank you so much.
Solo para agregar un poquito, el horario es de 4 de la tarde a 7 de la noche.
Thank you so much, Araceli. Appreciate that.
Thank you.
I have a brief announcement, a little fun thing. The Silicon Valley African Film Festival is this weekend. And in fact, I have a short film and it's showing Saturday at 12:30. So if anybody feels inclined, I'll put the discount code in the chat if anyone has time, wants to see any part of the festival. But it should be a good time.
So Derek, unfortunately, we don't have our chat featured on this
Oh,
call. If you can email it to us, to Carlos or to myself, we'll get it
Okay, I'll
out.
do that.
Great,
Yeah.
thank you so much.
I'll get an email out either tonight or first thing tomorrow morning. So if anybody was recommending, if they can send it either to the CMO, the General Task Force, and also to me, I'll make sure we get it out.
And Dolores, I see your hand.
Oh, you're muted.
You're on
Dolores.
mute, yeah.
Okay, good evening, everyone. I'll send Carlos this information. We are aggressively recruiting folks who will probably qualify for Medi-Cal under the new regulations, you know, with the expansion, even for folks who are here without legal status. So I will send you that out. We'll be launching in the next day or two, and then we'll be enrolling people for the next 3 years, you know, so it's really a great opportunity to get good health coverage. Thank you.
Great, thank you so much.
Mhm.
Really, really important for our community. That's
Yes, very. And we also have a product for folks who would not qualify for some reason for Medi-Cal. There's a local product as well, local coverage.
great, great. Good resources for our community. This is great. Anyone else? Christine,
Nothing to announce, but I do have a quick note that I noticed that the closed captioning is not working on my end, and I don't know whether others are experiencing that too. And if it's not on, we need to turn it on.
we most definitely do. So I'm checking to see if I can get it to work on my end. Going to ask the team, that'd be Katarina, to help us out, make sure that
Yes, closed caption should be on.
should be on. Okay,
It works for me.
great. Okay,
I'm seeing it as well.
Okay, just wanted to make sure.
thank you.
Thank you, Christine.
Okay, any other announcements? All right,
Wait, I see Araceli. Did you?
I'm sorry.
Sí, yo. Gracias. Tengo aquí, va a haber una gira interconexión. Es un nuevo desarrollo de uso mixto en Quetzal Garden. La agenda es de 5:30 a, permítame, no se ve muy bien, 5:45. El 14 de octubre de 5:30 a 7:30, perdón. También te lo envío si gustas para que lo puedas compartir y se vea un poquito más. Sale en 10 la registración y va a haber refrescos y aperitivos incluidos. Les envío bien la información para que podamos ayudar a distribuirla.
Great, thank you so much.
Thank you, Araceli.
Appreciate that. Okay, a lot of good news. Anyone else?
Yeah, this is Raimundo with Gardner Health Services. We're also having a Dia de los Muertos run on October 29th in Alviso at 7 a.m.
Awesome, great. Thank you for sharing, Raimundo. Matthew,
Yes, this is Matthew Reed from Silicon Valley at Home. I would like to extend an invitation to everybody to our next Happy Housers event, which is Wednesday, October 26th. I will share the link. We are co-sponsoring with the San Francisco Foundation, San Jose State University Institute of Metropolitan Studies. It's a tremendous opportunity for folks who are engaged in finding housing solutions in the county and in San Jose to come together and recognize that we're part of a whole. Thanks.
great. Thank you so much, Matthew. I like that. Happy housers. Really important for our community. All right. Anyone else? All right. Well, thank you so much for sharing. You know, our community really is pretty spectacular. I mean, a lot of information that we want to share with folks who really do need to be connected to services and resources. So thank you so very much for sharing all of that. Okay, I think we're now ready to jump into the main part of our agenda this evening. Oh, so before we do hear from our committees, I just want to spend just a moment to talk about how we got here, because it's been quite the process the last several months. And just a reminder that, you know, one of the things we set out early on in the task force is the whole purpose of establishing the committees was that the committees would really do the hard work in terms of coming up with goals and strategies and draft recommendations. And then also to incorporate all of the feedback that we've gotten from members in our community over the summer months. And so I know it's been a lot of work. I know many committees have been meeting multiple times. And so many thanks to all of you for your hard work. Also want to acknowledge city staff who have really served as tremendous resources. So getting information to our committees, you know, providing information on existing services that are currently being provided for members of our community. So it's been really good. It's been a lot of support and collaboration with our city staff, and we think that's really important. So thank you for that. And a big milestone for us, right, this evening, all of this work has resulted in a total of 87 draft recommendations that are being considered. That's really amazing. Also, you know, we remember that the city council, when they approve the city's budget back in June of this year, $2 million of American Rescue Plan funds was actually set aside for this task force and for the different recommendations that you might come up with. And so $2 million has been allocated or suggested to be allocated to 9 specific recommendations, and you're going to hear more about that this evening. So we have asked each committee to share with the full task force, you know, their top draft recommendations that they've been working on, up to 5. We think some committees may have a little bit more than 5 to share that this evening, and that's fine. And I do want to emphasize that where we are now is it's a big milestone, but it still is a work in progress, right? And so these recommendations are still in draft form. They're for discussion purposes, and we anticipate some really good, robust discussion this evening. And so there is opportunity to make further refinements if needed, and just wanted to make sure that everybody understood that. And lastly, we do acknowledge that you all just received this full list of 87 draft recommendations 2 days ago. And we know it's a lot of information to take in. Totally understand if everybody hasn't had the opportunity to get through them all. And for many of you, it's really been the first time that you've seen the work of the other committees. So you've been involved in, you know, the committees that you've served on, but you haven't seen those draft recommendations that other committees have been working on. So we know that it's a lot of information to take in, and we do have time to continue to review and to refine. So want to make sure that was clear with everyone. So with that, I think we are ready to just jump right into the first presentation, and it is coming. Oh, let me stop. Any questions before I move on? Any questions on how we got to where we are now? Thank you for stopping me. I don't see any hands. All right. So we will then go into our first presentations coming from the Child Care, Early Care and Education and Youth Development Committee. And I understand that Dr. Marianne Dewan and Yvonne Perez are going to be presenting.
I believe it'll just be Yvonne, but.
Oh, Yvonne. Okay, thank you so much.
Thank you, Ms. Rosalind. Yes, good evening, everyone. So our committee's goal is to expand access to affordable, equitable, and high-quality programming in childcare, early care, and education and youth development. So today we have 5 recommendations, and the first recommendation is action 1.1, which is expand and increase the capability of small business support and quality improvement services. For example, training, capacity building, and credentialing for childcare and early care providers. So for example, leveraging existing city programs to provide support to Santa Clara County, First 5, and other stakeholders in building a sustainability plan for ongoing efforts to develop a countywide shared service alliance, SSA, for family childcare homes, FCCH, providers to have access to small business, programmatics, and instructional support services. An SSA is a partnership of childcare providers working together to share costs and deliver services streamlined and efficient. This allows providers, especially in low-income communities, to share some portion of the financial burden of operating a high-quality program. The second recommendation, action 3.1, is to enhance outreach to low-income families to better connect them with childcare, before and after school programs, and other youth development programs through the city's Pilot Promotores program. To elaborate a little bit on that, is to help strengthen the knowledge, the skills, and awareness among promotores in the city's Pilots Promotores program about existing childcare before and after school programs and other youth development programs. Our third recommendation, action 4.3, is to expand childcare, early care, and out of school time programs in zip codes more impacted by COVID-19. So that would be fund family childcare homes and youth development programs in zip codes most impacted by COVID-19. Use existing data to collaborate with regional stakeholders in meeting the needs for childcare, early care, and out of school time programs in zip codes most impacted by COVID-19 and during after hours and non-traditional hours. So $200,000 is the proposed allocation to support this recommendation. Additionally, we have the fourth recommendation, action 5.1, which is to expand training on trauma-informed and trauma-responsive practices, to build upon existing trainings offered by the county on trauma-informed care and trauma response approaches for childcare and out-of-school time providers of all age groups, including childcare and youth development staff from nonprofit organizations. Our last recommendation, action 5.3, is to expand behavioral health programs for children and youth, to leverage and align funding and partner with local school districts in intentionally expanding mental and behavioral health programs and services, especially for children, youth, and families in a ready-to-go approach. So those are our 5 recommendations for today. I'm gonna give back to Rosalind. Thank you.
Thank you so much, Yvonne. Really appreciate you sharing and highlighting these 5 top recommendations from your committee.
Thank you.
Carlos, I think you're probably up next, community engagement.
So the next would we have Araceli Gonzalez, I believe, who will be sharing the recommendations for community engagement. Araceli, are you there?
Yes. Thank you, Carlos. Thank you, Rosalind. Thank you, Carlos. And thank you, everybody, for your time. So our community engagement goal was to educate and connect families with various community resources. Conduct deep community engagement about what is the need for the recovery. And thank you all for whoever participated in our event. Much appreciation. The community engagement has 3 actions. The first action is to continue and expand the COVID-19, the recovery task force of the pilot of the Prometoras program to build awareness and recovery resources offered by the city to the and community-based partners. The recommendations is to expand of that for $100,000. In regards to that resources, information, including the workforce developments, programs for childcare, housing, community health clinics, and to include the Filipino, Vietnamese, Asian, Latino, and African American communities. We've been seeing great resources coming from the Promotora program. Our second action is 1.2, involve the community to simplify forms needed to access the importance of the recovery resources related to housing, workforce development, small business, and after-school programs. Consider starting with those related to housing resources. We feel that this is a great need in the community and the people that we're serving. Our next action is to consider having the city to host an annual recovery resource fair and other engagement activities to directly connect residents for recovery resources. And our recommendation is about $15,000 to be put aside for this. Activities should be different in different areas, different neighborhoods that have been impacted most in the pandemic. Having different organizations like yourselves be part of this resource fair is something that we're really wanting to push. And that's the end of my slide. Thank you.
Thank you, Araceli. I believe the next committee is Community Health and Wellness, and we have Chair and Co-Chairs Victoria Ramirez of the Health Trust and Dolores Alvarado of Community Health Partnerships on hand to share summary of these recommendations.
Thank you, Carlos. I'm going to take the first slide and Victoria will follow up with the second slide. So one of the challenges we had, and I'll get to the goal in a minute, is that the county has been primarily the entity that has provided healthcare in this county. You know, they've been responsible for any and all sorts of healthcare, not just clinics and hospitals, but emergency response, etc. So you are going to see after the second slide, when you look at the 87, that there are many, many recommendations that talk about the linkage that has to happen in the alignment with the city. So County of Santa Clara and city, so that there isn't that separation. I really want to bring that up because I think that's something that can be done without funding. You know, it's an administrative principle that we would like them to follow. So in that vein, our goal is was and is to proactively foster community health, safety, and wellness in the city of San Jose by incorporating the social determinants of health into the city's program and decision making. And for those of you that may not be familiar with the term social determinants of health, it's a new term. However, the concept is not new. It's been around for about 60, 70 years. And what it means is that defining health from a perspective of environment, meaning it's not just whether you're sick or not, but everything that influences you as you grow up. Living in an area without trees, less oxygen, living in poverty, etc. So again, a lot of people think it's a new thing, you know, like we invented it. We did not. It was invented many, many years ago at UC Berkeley. It wasn't invented, it was already there. In any case, it is a very different perspective and a very comprehensive perspective. So it will necessitate some change of policies once you start looking at the entire environment of a person's life. So thank you. Victoria, are you going to do the second slide?
I'm not doing the whole slide. I'm going to take the first recommendation.
You stop where you want, and then I'll speak.
Yeah, so our first recommendation that we're presenting to the committee today is to support career training programs for community health navigators. And really what we were looking here was to develop a partnership with community health centers, community colleges, and other stakeholders to provide funding to support career pathways for folks working in health. And Dolores, you want to take the next one?
Sure. This is really what I was talking about earlier. Create a collaborative cross-sector emergency response action plan and facilitate efforts to include community health centers, nonprofit safety net organization as core partners. What we mean by this is that even though the community health centers are funded by state and feds and the county and managed care, Medi-Cal, really most of them are in the city of San Jose. So why not create that partnership with the city and the county to have to together plan for any type of emergency so that our role as community health centers is defined up front. And I think the outcome will be better. Again, that doesn't take money. It just takes las ganas for people to sit around a table and really plan collaboratively. The next one is strengthen food distribution programs for low-income, food insecure households. That definitely comes from the perspective of social determinants of health, because we know that what we eat has a great impact on our health, particularly with folks who have chronic diseases. And really, it's just to strengthen the current programs that are established. Do you want to go next, Victoria?
Our next recommendation is to provide additional funding through the city's Senior Health and Wellness Grant Program to support an increase of chronic disease education, especially diabetes management and prevention. And here we're looking at possibly increasing grant funding to partners to provide chronic disease education during senior nutrition distribution periods, and explore opportunities to expand current health and wellness workshops being offered at neighborhood centers and community health centers. And the last recommendation that we're presenting today is to simplify the permitting and MOU process for health and social service providers. And here we want to explore a policy or ordinance or an amendment to simplify the permitting and MOU process for partnerships with nonprofit organizations and health and social service providers to more quickly provide services to high need populations and in times of emergency as we experienced during the COVID pandemic.
Thank you, Victoria. Thank you, Dolores. I believe the next committee is housing. And Aurelia, did you want to introduce the committee chair?
Sure. Good evening, everyone. My name is Aurelia Bailey, and I'm sure many of you already know I'm also part of the city's recovery team. But before I hand it off to our next speaker, I just wanted to remind again everyone to make sure that if you want to hear the interpretation piece of this presentation, that you are in the English channel. So with that said, I will hand it over to Araceli Sierra from Somos Mayfair.
Muchas gracias. Pues primero que nada, quiero agradecer a los miembros que estuvieron con nosotros en este comité de housing, que fue su servidora, David Lowe de Destination Home, Matthew Reeds de Silicon Valley at Home, Sparky Harlan de Bill Wilson Center, Jordan Grimes de Greenbelt Alliance y Araceli González de Catholic Charities. Nosotros estuvimos formando parte de este comité de housing y nuestra meta, como pueden ver, fue el garantizar que todos los miembros de la comunidad de San José tengan acceso a viviendas económicas y estables. Para esto, si pasamos a la siguiente diapositiva, por favor. Estas fueron nuestras recomendaciones. Sé que todos tuvieron tiempo de verlas un poquito antes. Si no, los invito a que las vuelvan a ver. Fueron algunas de las que resaltaron, aunque hay más en la página de la ciudad. Como número 1 tenemos a priorizar los vecindarios y los residentes de bajos ingresos más afectados por la pandemia de COVID-19 en los esfuerzos continuos de asistencia para inquilinos y en la ayuda de prevención de personas sin hogar. Un ejemplo es hacer una priorización de la asistencia para vivienda para los residentes de ingresos extremadamente bajos o aquellos que ganen menos de 15,000. Y también aumentar los fondos de la ciudad destinados a asistencia para inquilinos con el fin de poder igualar el nivel de necesidades en la comunidad. Ese fue nuestro punto número 1. Nuestra acción número 1 de 3 es patrocinar o apoyar la legislación estatal para ordenar que los tribunales locales publiquen datos de desalojo. Estos datos de desalojo deben incluir retenciones ilícitas de inmuebles registrados y también desalojos ejecutados por el tribunal. Para nuestra siguiente acción, si podemos pasar a la siguiente diapositiva, por favor. Esta acción 4.1 es poder financiar organizaciones comunitarias locales para conducir divulgación sobre derechos de inquilinos, la tenencia de vivienda y programas y servicios existentes de vivienda. Con esto queremos poder financiar organizaciones comunitarias locales con el fin de llevar a cabo un alcance auténtico y culturalmente relevante para los residentes de comunidades prioritarias de equidad. Estas organizaciones comunitarias apoyarán mediante una mejor educación y sensibilización sobre derechos de los inquilinos, así como programas y servicios en materia de vivienda de la ciudad, el condado y el estado. También adicionalmente, financiar organizaciones igual sin fines de lucro para educar a las comunidades sobre cómo convertirse en propietarios de vivienda y poder explorar diferentes formas de comprar una vivienda y brindar información sobre incumplimiento y asistencia hipotecaria. Esos son algunos puntos que resaltan en esta acción. Esa es el 4.4. ¿Nos falta una? O ya, si nos falta la acción 4.2, ¿verdad? Es que se mira chiquita. Es desarrollar un centro de recursos para inquilinos en línea multiplataforma. Con esta acción de 4.2, queremos desarrollar un centro de recursos para inquilinos en línea multiplataforma que pueda apoyar el acceso a protecciones locales y estatales para inquilinos, incluyendo el derecho a organizarse y contra represalias también, como una extensión del Centro de Ayuda para Desalojos, que está coordinado con otros recursos de la ciudad, incluida la aplicación receptiva de códigos, entre otros. También queremos garantizar que los recursos estén disponibles en varios idiomas, asociarnos con organizaciones comunitarias para garantizar que el sitio de recursos en línea esté dirigido por la comunidad y se actualice de manera continua. Desarrollar también los materiales que vamos a compartir en este sitio, que sean de educación popular para el sitio web y también que se puedan imprimir y distribuir fácilmente de manera presencial a los residentes. ya que también entendemos que a algunos es difícil para ellos acceder al Internet, pero cómo puede llegar esta información a toda la comunidad, todos los residentes. Pues igual para el Comité de Vivienda, con la guía de la ciudad estamos recomendando 130,000 para esta recomendación, como pueden ver ahí, para la 4.1 y 4.2. Estamos recomendando la misma cantidad, ya que fue todo con lo que podíamos acceder sobre recursos económicos. Pero también finalmente me gustaría agregar, aunque el Comité de Vivienda estamos de acuerdo con estas asignaciones de fondos, todos también estamos de acuerdo que todas nuestras recomendaciones necesitan más fondos, especialmente para lo que es la asistencia de emergencia para inquilinos y en la ayuda de prevención de personas sin hogar para los residentes de bajos y muy bajos ingresos. Como pueden ver, todas nuestras recomendaciones nos parecen muy importantes. Creo que tuvimos una súper conversación sobre ello, pero sí nos dimos cuenta que, y también si lo pueden tomar en cuenta, que todas nuestras recomendaciones realmente sí necesitan tener más fondos. Gracias. Si se me pasó algo y gusta agregar algún compañero, con gusto.
Gracias, Araceli. Thank you, Araceli.
Thank you, Araceli. You covered it well, so thank you so much. The next presentation, I will hand it off to Ben. Ben co-chairs the Just Recovery for Airport, Hotel, and Arts Workers. I know Sam from SEIU couldn't be with us tonight, so with that, Ben, I will hand it off to Ben.
Okay, thank you, Ariana. So our committee was, our goal was around revitalizing hospitality, travel, and especially with a focus on airport and then the arts for both the industries and the workers. This industries segment for San Jose was among the most impacted in terms of lost jobs during COVID, and has been among the slowest to recover jobs on the other side. I'd like to say a big thank you to everybody on the committee that worked with us, Sam Kahinde with SEIU, Sarah McDermott, Unite Here, Roy Hirabayashi with Molly and the School of Arts and Culture, Brendan Rawson with San Jose Jazz, and Monique Melker with Work to Future. Can we go to the next slide, please? So our draft recommendations really kind of fell under two broad strategies. One was really focused on hospitality and entertainment sectors, the fact that we haven't returned to full employment. So the first recommendation there, 1.1, was consider changes to the city's opportunity to work ordinance to lower the employer threshold of 36 employees to 25 employees and to ensure as many full-time employment positions are afforded to part-time employees as possible. The members in our committee from the labor groups specifically cited that it's been very hard for them to return to full employment in the current conditions. So we really wanted to address that. I think it's also important for us to note that a lot of the discussions in these topics were also around wage and wage rates in the hospitality sector. We understand that the Workers Committee is looking into some recommendations around revisiting minimum wage and those things, and that aligned very much with our group. And so we wanted to just also mention that here, that we would be endorsing those recommendations from that group. The second one was around creating a collective impact employment program for upskilling of low-wage workers. So this was really looking at setting up a partnership with local and regional employers to create a collective impact employment program for low-income workers that would design customized training programs considering existing skills such as either hospitality, food service, caregiving, construction, and support upskilling of those workers via an earn and learn model. So an example would be the San Jose State University partnering to expand their hospitality, tourism, and event management program to provide training certificates and upskilling opportunities for low-income workers through local hospitality employers. Our second area of focus really came around re-energizing travel demand to ensure short and long-term sustainability for the hospitality industries. And a lot of the focus was around transient occupancy tax. That's the hotel bed tax, because that not only funds the marketing activities to generate that travel demand, it's also the main source of funding for the Office of Cultural Affairs Arts Grants program that the arts community largely depends on. So our recommendation 2.1 was to explore dedicating the TOT resources for the long-term recovery and growth of the arts and visitor industry. And specifically, this was to look at, to provide for the ongoing recovery and growth of the arts and hospitality sectors through this TOT fund after state and federal relief ends. And that specifically was related to considering using the 40% of hotel bed tax that currently goes into the general fund to reinvest in arts, entertainment, and convention business stimulation through targeted programming, marketing, and associated infrastructure improvements. And looking also into the facility costs required for performing arts groups to use city-owned spaces. We also had our recommendation 2.2, which was to encourage the city to develop alternate funding scenarios to address the long-term stability and sustainability of the arts and visitor industry, with volatility in the hotel bed tax, really to look if there are alternate funding structures or means for us to provide more stability, specifically to our arts groups. And then finally, recommendation 2.4 was to provide subsidies at city-owned venues prioritizing small and mid-sized arts groups. The smaller and mid-sized arts groups have really struggled in terms of re-establishing funding and their ability to bring arts and culture to San Jose. And so this was really looking at an opportunity to help to jumpstart the funding around that. And there was a OCA attached recommendation for $100,000 to this program. I think it's also important to note that a lot of the conversations that we had around this was also based on looking, and it's in our other recommendations, to look at the funding or at the fees and costs for arts groups to utilize city spaces. They sometimes get a lot of grants that they do receive from the city, then get put right back into the city for services and fees necessary. So to really look into a study at how barriers to entry into city event spaces could be removed for the arts group to help move that forward. So those are our top 5 recommendations there. Thank you.
Thank you so much, Ben. Really appreciate that overview. I believe the next committee that we have is the Supporting Small Businesses Committee, and we have chair and co-chairs Christine Fitzgerald of the Independent Living Center and Jesus Flores of the Latino Business Foundation of Silicon Valley here to share a summary of these recommendations.
Thank you very much, Carlos, and thank you, everyone. First, I want to say thank you to all of the committee members for their great input, for all of their hard work. Also, thank you to all the city staff. Thank you for all your support, Carlos, and for taking all of our phone calls. We always talk about local family-owned businesses. When I refer to my small businesses or the small businesses that we support, I will always want to emphasize that the businesses that we are supporting are very small businesses. When we say very small businesses, these are small businesses with 10 or less employees. There are currently 19,600 very small businesses in San Jose. They sound small, but these 19,600 very small businesses create close to 100,000 jobs in the city of San Jose. We call them local family-owned businesses because they are local. They live here in our neighborhoods, and their employees are also local, and the kids or the employees and the kids of these business owners go to school with our kids as well. So they're our community as well. That's why, and that is the importance of these local family-owned businesses. So again, I want to say thank you to our committee, and I want to say thank you, Carlos, and all of the city staff for their support. We are going to be presenting 5 of our top 8 to our 8 recommendations. But first, our committee goal. Our committee goal is to support small businesses to recover from the impact of the COVID-19 pandemic by providing necessary assistance tailored to their specific needs. And again, we're going to be presenting 5 of our 8 recommendations. Christine?
Okay. Good morning, or good morning, excuse me, where am I? Good evening, everybody. Good to see everybody. Glad everybody's here. And thank you also to the city staff for all of their efforts. Well, let's look at number 1.1. So the idea is to assist businesses that have 10 or fewer employees in their company, making sure that rent relief and equipment for better safety standards and storefront grants. Looking at other financial assistance to help people recover, and making sure that the grants are available to everybody. People who have already applied for grants can do so again if it's not under the same grant that they had previously been involved with, just to make sure that everything is equitable as possible. Say that 3 times fast. Okay. And I believe I pretty well covered 1.1. Jesus, did you want me to go on to?
Christine, I'll go with 1.2, and then you come back with 2.1. So our action 1.2, connect with and leverage existing city outreach programs like the Pilot Promotores Program and partnership with community-based organizations and business chambers. Sorry about that. In business chambers who work with undocumented individuals, women, Black, Latinx, Asian, people with disabilities, and older adults, non-English speaking, and LGBTQ+ business owners to promote existing and future funding opportunities, City of San Jose access programs, business tax license exemptions, participating in the city contracting process, ADA compliance resources available, such as the CASP grants, San Jose Public Library, computer literacy classes, and other business development resources that support the small businesses impacted by the pandemic. Christine.
Thank you, sir. Hold on 1 second while I put my earpiece back in, because I listen to what I'm doing when I'm doing it so that you don't have to. But I do. Okay, hold on 1 second.
Thank you.
Wardrobe malfunction, you gotta love it. All right, here we go. Okay, looking at 2.1. We're gonna look at continuing to partner with other organizations to provide funding and training, looking at learning how to file, learning how to do taxes, and the like, to make sure that they are well prepared for what they intend to do in their business. This particular opportunity right now, we're looking at the possibility of funding at about $150,000 to work with this. And to go back 1 second, I missed the opportunity to say this on 1.1. The recommendation there is for $600,000 to go towards 1.1. Jesus.
Christine, our action number 2.4 is to develop grants to cover construction costs to support small business owners to meet ADA compliance. We know of this huge need for many of our small businesses. So this is something that we emphasize a lot. And Christine, thank you for all your input, by the way, in this item. Christine, can you help us with action 2.2, please?
2.2, you said, yes?
It's 3.2.
All right, here we go. So we're looking at leveraging the partnerships in the Latino and...
I think it's 3.2, Christine.
Oh, you need me at 3.2? I'm working off of the document you sent the link to.
Yeah, I mean, you can mention 2.2 as well as, but I guess 3.2 is the one that's listed on the screen right now.
Okay, hold on 1 second. I could do 3.1 or 3.2. Excuse me.
Thank you, Christine.
3.2. Here we go. Okay, we're looking to expand the Wi-Fi connectivity throughout Santa Clara or throughout San Jose to make sure that they have access to broadband internet, whether they are in their offices or we can out of their homes. It should not matter. The concept is to make sure they have the tools and the resources that they need to do their business, and broadband Wi-Fi is of extreme importance.
Thank you very much, Christine, and thank you again, Carlos. These are our recommendations, and I just want to say again, thank you, Christine, for all of your support, for all of your great work. Thank you.
Thank you, Jesus, for all of your input and knowledge and skill.
Well, thank you, Jesus and Christine. So the last committee we have tonight is the Workers' Health, Safety, and Rights. And I will hand it over to Louise from Working Partnership.
Okay, thank you. So these are the recommendations from the Workers' Health, Safety, and Rights Committee. As first, I want to apologize if my voice is muffled. I am wearing this elaborate mask because I've had COVID for the past several weeks. And I bring that up because I know I'm far from the only one in our community. We may be facing another surge, and I think it just highlights and lifts up the importance of all the work this committee's been doing over the past year, and the work of moving these recommendations forward, recognizing this is something all of our community members are still very much dealing with. So for the Workers' Health, Safety, and Rights Committee, we identified 3 broad strategies. And I'm going to go over those rather than read off all of our actions. So our first broad strategy involves focusing on workplace rights outreach, education, and enforcement, both expanding the city's role in outreach and education around workforce rights and connecting the city with other agencies and community and business organizations to help leverage and build existing capacity. Could we actually stay on the first slide? I'm not on the actions yet. If that's possible, thanks. So that was the first strategy. Our second strategy was to strengthen workers' rights and safety enforcement tools at the City of San Jose.
And by tools, we meant mainly actions that the city council could take to enact or change ordinances, to change policies, to give direction to the city attorney's office, really to strengthen or improve the tools that are at the city's disposal to help protect workers' rights and safety. And our third big strategy was around expanding access to paid sick leave, looking at both paid sick leave for COVID-19, recognizing that that's going to continue to be a need, and the sort of yo-yo up and down of the state policy is hard on businesses and workers. And second, looking at permanent paid sick leave, something more than the 3 days per year that the state provides now. So those were the three broad strategies. And if you want to go to the next slide now. And these are examples of some of the actions under the strategies. I won't read each one off, but these are sort of representative of our broader set of actions, which is in the full report that you've seen. And we really designed our actions, they're almost like puzzle pieces. Underneath each of those three strategies, the actions fit together and reinforce each other and complement each other. So for that reason, we didn't necessarily prioritize one action over another, but we really were looking at how all of the actions could fit together. And so I'll stop there. Thank you.
Thank you, Louise. I will hand it back to Rosalind. I will hand it back to Rosalind for the next portion, which is the Q&A discussion.
Okay, thank you so much. So again, just many thanks to all of the hard work over these last several months. We really do appreciate it. You all have been volunteering your time. City staff, we get paid to do this, and we're happy to assist as we can, but we do want to recognize and acknowledge the time that you're taking out to help craft these recommendations, and it's really been a lot of tremendous work. So with that, we're just going to stop talking now and just open it up for discussion. Any clarifying questions anyone may have? Dolores, you are on mute.
I'm on mute. Oh my gosh, I'm so sorry. Would it be possible to start from the top with each committee and just have it on the screen so that then conversation can happen?
That's, I think, is a great idea. So why don't we go back to the first committee, which I believe it's childcare, early care, education, and youth development. So we can go back just and show the list of their top 5.
Thank you.
Draft recommendations. Sure. Can you go to the recommendation slide for this? There we are.
I have a comment about this. It's just really more of a comment than a question. Is that okay?
Absolutely.
Yeah. So action 5.3, and there was the person that was speaking talked about behavioral health programs and expanding them in the city, but there was no mention about working with the county on this. Was that excluded on purpose, or just understood that it would be the county as well? Oh, I know they mentioned that they would be working with the schools.
Yeah, well, I think we can definitely add that to the count. We can add the county as one of the partners that we would be we could partner with.
If that's agreeable to the committee. That was more of a, I guess, a question or a comment.
No, and that is definitely, this is Yvonne, and that is a very valid comment. So thank you.
Okay, thank you.
Any other questions or comments regarding this committee? I see Rachel and then Derek.
Hi, I'm Rachel Monaco. I'm with Second Harvest of Silicon Valley. I just had a comment under action 4.3 for expanding childcare, early care, and out-of-school time programs in the zip codes that have been impacted by COVID-19. I was wondering if under the in the more detailed section, if there was a specific call out to where those programs are eligible to use nutrition programs like the Child and Adult Care Food Program or the Summer Food Service Program to ensure that the children who are participating in these programs have access to meals while they're in this care. In particular, I wanted to call out the Summer Food Service Program for the summer meal locations that the City of San Jose operates at their summer camps. Those sites are often closed sites so that only the children who are actually participating in that summer camp are able to eat at that site. But those locations are often in areas that are eligible to serve any child in the community. So I wondered if there could be a consideration for opening up those sites, for making them community feeding sites.
Thank you, Rachel. And this is for action 4.3 for child care.
Yes, it is.
Thank you for that comment, Yvonne. We were very focused on providing childcare, and all of your comments are greatly appreciated and great additions to our action items. Thank you.
Derek?
Yes, thank you. And again, thank you, Rosalind and Carlos, for meeting with me this afternoon. I felt very confident in the outcome of our meeting. Just to reiterate for everybody, there's a lot of language in all of these recommendations: strengthening, continuing, increasing, expanding, connecting. We need to continue to make sure. I know you said this is a work in progress, but we need to continue to make sure that there are clear goals, measurable objectives, and that there are metrics and benchmarks that we can measure success. We have to have parameters where we can measure the results, because if you can't measure it, you can't improve it. And so that we're clear about what we're doing, and also in general, how we're meeting the needs of all our community, particularly our Blacks, Latinos, people with disabilities, the groups that have been continuously marginalized, and making sure that they have equitable access to events, not just saying that, but really defining how that's going to happen, and making sure that the small business community, which I'm also on, minorities get their fair share of business contracts. So I know you mentioned this is a work in progress, and I appreciate your efforts and the efforts of everybody on the task force. I represent the Black Leadership Kitchen Cabinet on this task force. And by the way, Rosalind and Carlos, I put the Silicon Valley African Film Festival discount code information in your email.
We just got your email. Thank you so much, Derek. We just got it. Yep.
I have another obligation. I'm sorry, I need to leave at this point, but I wish everybody well, and thank everybody for all your efforts on this committee.
Thank you so much, Derek, for your participation.
Thank you.
And I just to piggyback on Derek's point about, and we know how important this is really to everybody in terms of developing those outcome metrics. It's super important. It's important that we create new programs and provide resources, but at the end of it, we do want to be able to measure what we hope will be success and improvements, right? And we know that's particularly important to our city council as well. And so I did just want to mention, and Rob, I'm sorry to steal your thunder, but Rob Lloyd at the end of the meeting, he'll be sharing more from the Data and Budgeting Committee about their work in coming up with metrics. So you'll hear more about that.
Any other questions on this committee before we move on to the community engagement, I believe? Okay, so we can go to the community engagement.
Carlos, I'm sorry, just before you move on, because back to 5.3, the comments, if you could go back. Yeah, I just wanted to also note, as I looked at our chart, that this recommendation was also tied to the work in the city manager's office around the child and youth development master plan. I may have the title wrong, but it's a master plan around child and youth development. So I just wanted to also just make that point, that that plan is getting ready to launch, probably already underway. So that's something that will be coming, I think, to the city council sometime next year. All right, we can go on to community engagement. Any questions, comments, any clarifications needed? I did want to note that in some of the recommendations from other committees, it was noted the importance about reaching, right, our residents and the people who need the resources. We got that feedback during the community engagement process. In fact, that just many people didn't know, right, about the existing resources and services. So it's just really important that we find ways to connect people, and just good to know that many other committees mentioned the promotores program and how effective it is in terms of having promotores in our neighborhoods, connecting people to services.
So community health and wellness. Any questions on these or the other recommendations that they have on their within their committee?
I want to make a comment in case there's any other questions. Is what I'm noticing, there's a tremendous amount of overlap already, which is great. You know, like you mentioned, Rosalind, and I see that the food issue here correlates with the previous comments about having food also at the place where children are after school, etc. So I think that'd be interesting to point to the city council that even though these are individual, they really do overlap and correlate.
That's a great point, Dolores. It's so important. And
it's so now. I didn't see it until now.
Yeah, yeah. All right, looks like we're moving on to housing.
This is Yvonne. Oh, sorry, I forgot to raise my hand.
That's okay, go right ahead. Go, Yvonne.
My apologies. This is just an idea that just came to me based on what Ms. Dolores just mentioned in regards to the previous action item. I can't remember if you could go back, please, to the previous recommendations. Yes. So for the action 2.6, I was thinking it would be very creative and nice to have a program where senior citizens are able to educate younger children on nutrition. And I'm saying this because of two reasons. One of the challenges that a lot of seniors are experiencing is loneliness, and that they're not engaged in the community for various reasons. So that would be a great way to engage, you know, seniors into the community by helping educate children at the same time, mirroring that, you know, what good nutrition looks like and so on. And it would be a great way to have children who have lost a loved one due to the pandemic to be able to engage with someone like a, you know, a grandparent type of figure. I think it would be a very engaging and a win-win for both, because I think a lot of our children were affected by the pandemic tremendously, and similarly our senior community has been affected as well. So it's just a comment.
I think that's a great idea, Yvonne. That's a brilliant idea. Thank you.
Thank you.
Yeah, thank you, Yvonne. I know that with, the community centers having opened up again, there's more opportunities for seniors to go out. I know that one thing that we've heard around the senior health nutrition program, which was for a long time during the pandemic, people would just pick them up or pick up their meals instead of the way that they had been normally done, which is seniors coming into the community centers and feeding and having lunch there. So just the senior health nutrition program opening up to becoming in person or sitting in the community center and feeding and having their lunch has been it's not one of the big reasons is to be able to give seniors a chance to go outside of their homes and reconnect with others. And so I think that's definitely something that with the community centers opening up and providing more opportunities for seniors to come to community centers to connect with other folks as well. So thank you for that.
Well, Carlos, but this particular one, the Health and Wellness Grant Program is a little different.
Yeah, I guess I'm more on the general side.
Oh, okay, general. Yeah. Okay, thank you. That one is clearly management.
Yes.
Chronic disease management. Thank you. Which also makes sense, though, based on Yvonne's comments. Totally makes sense.
Thank you. Louise, I see your hand up.
Oh, I had a question about the housing section. I'll wait till we get there.
Okay. Christine, did you have a question on this?
I just had a quick comment, and I know that it made me kind of parsing things in an odd way, but let's not forget when we talk about senior centers, let's not forget about senior daycare centers, because in that way, again, we're making sure as much of the community is involved and keeping brain health going. Thank you.
Christine. Okay, I guess we can go with you, Louise. We're with housing.
Thanks. Yeah, I just had a question, and maybe for the people who are on this committee, of how it was decided to put recommended funding to 4.2 and 4.1, but not funding to 1.1. And I mean, I understand there's a much bigger conversation here of 2 million is kind of a silly amount to try to do all of this recovery work. And I think there's a bigger conversation about how do we move this towards next year's budget. But I just was curious, why fund outreach and an online platform initially rather than putting funding into direct rental assistance?
I see Matthew Reed has his hand up. I know he was a member of this committee. Matthew?
Yeah, it's a good question, Louise. So originally, all of the money was in 1.1, and we talked about it as a committee. The expectation is that emergency rental assistance and homeless prevention budget will be about $8 million next year. And so the committee made a decision that that small amount that we had control over was not going to have a huge impact. And that even though the 8 million was far short of what we knew we needed, that we would focus the resources through this process into trying to strengthen process and system pieces that we thought had been shown to be either lacking or really valuable during the pandemic. So that was the logic. It absolutely was not to understate the central importance of emergency rental assistance, but just acknowledging that in the budget context of what was going to go there and how much we had to work with, that wasn't where we would put the money.
That's really helpful. Thank you.
Thank you, Matthew. Trying to see any other questions or comments on housing.
Go to the next committee, I think.
Okay, this next one is just recovery for airport, hotel, and arts workers. Have any questions or comments or anything needed to be clarified? Yeah, don't see any hands.
I think we can go on to the next one, which I believe is supporting small businesses. Questions, comments? Okay, I think if there's no questions, then we'll go to the last committee, workers' health, safety, and rights. Araceli, I see your hand up.
Sí. Pues no es específicamente pregunta, solo un comentario, viendo todos los de estos, solo como resaltar un poquito las similitudes y también algo que noté es casi en todos los comités se resaltó lo que es la importancia de trabajar con la comunidad, las promotoras y también de estar involucrados y estar asociados con esas organizaciones de la comunidad y las organizaciones sin fines de lucro. Me gustó escuchar que en la mayoría como que se integró en todos los comités. Es como tener eso bien en cuenta al momento de llevar las recomendaciones. Me encantaría ver que todas se hagan realidad, pero también cómo ser estratégicos en esa parte. Solo era ese comentario.
Thank you, Araceli.
I have a question on 1.2. Louise, could you speak a little bit? This was Louise, right? Who spoke? No.
Yes.
Yeah. On 1.2, like, what does that look like?
Sure. So the Fair Workplace Collaborative is actually very much what Araceli was just talking about. It's a collaborative of small community organizations and small business organizations that work with the county's Office of Labor Standards Enforcement to do outreach and education around workplace rights, both for small business owners to understand, what their responsibilities are, how to fulfill them, refer them to resources if they need them, and to workers at different businesses. And so the county has been doing this, and Working Partnerships is part of it, has been doing it. It actually started just before COVID, was put on hold for a little while, but now it's back again. But the City of San Jose has their own office that isn't really involved or connected to that effort. So this would involve figuring out how to dovetail and work with this existing infrastructure, which involves a lot of Pawis is part of it, who reaches out to a lot of the Filipino community. I think Prosperity Lab. I'm sorry, I don't have all of the names at the tip of my head, but a lot of organizations that reach specific communities of workers and having them work more directly with the city's own Office of Equality Assurance.
Thank you. So would it make sense, or is this totally different, to include 3.2 in 1.2? Or is that totally different?
So I should say our committee didn't pick these 5 recommendations to showcase. 3.2 actually is sort of so number 1, yes, it does. And number 2, 3.2 came after 3.1, which was a recommendation for the city council to actually consider extending sick leave rights to more workers.
I see.
So that was sort of the bigger recommendation. And then we said, you know, if city council passes new laws, we should make sure that people know about them. But yeah, I think if that happened, they could go together.
Okay, great. Thank you. Thank you, Luis.
Yeah.
If I may. I just
Go
wanted
ahead,
to
man.
comment. Hi. So today, me and co-worker of mine, we're out there at Calle Willow and doing the Fair Work Collaborative work, the contract that we were awarded, and just talking to the business owners and just letting them know what the resources are that are out there, not just from the collaborative, not for just from the county, but because we're so engaged in so many different organizations, bringing them the information regarding, you know, Al Fresco program and the what do you call it? Just all the programs that are out there. So combining these two, the city and the county, I think makes a lot of sense if you guys use the resources that we have and just bring in the city and the county together. So we're out there doing the work already. So, you know, bringing in this information, allowing us to get out there and talk to the business owners, to the community. I think it's a win-win for everybody. And just wanted to piggyback off that comment earlier.
Thank you so much, Armando. Any other questions on this committee or on the other committees or in general?
Okay, if not, well, thank you so much. If we could go to that next slide. Yeah. Again, just thank you again for all of the comments and the feedback. Very helpful. Staff has been capturing the conversation. And so we just wanted to pause now to talk about where we're headed with these 87 draft recommendations that we now have. So I think last week when we sent out the original email to you, we were thinking that perhaps with all of the work at the committee level, that the full task force might want to put forward a motion and vote to accept these draft recommendations and the associated budget allocations. And perhaps if there was still a desire for more discussion or further refinements, that could happen at the steering committee level. And we have a steering committee meeting that's actually scheduled already for October 26th. Obviously, the steering committee is made up of the chairs and co-chairs of each of the committees, and the steering committee is open to the public. So the public will have the opportunity to listen in and provide comment as well. Also understanding that you've only had 2 days really to take a look at all of the 87 recommendations. You might want time to review. Certainly that makes total sense. And so you may not want to take a vote on anything tonight. You might want to have the opportunity to have a further discussion at that October 26th steering committee meeting. Long story short, we just want to share with you that we just have one meeting left, one task force meeting left, and that's November 10th. And so certainly at that meeting, we will need a final vote on all of the recommendations. So that's where we're headed. And I see that we have a couple of hands raised, and we're ready to take questions or comments. So Louise.
I think Gabriel was first, actually.
Oh, thank you for noticing that, Gabriel.
Yeah, thank you. So this is time for public comment?
No,
It's not time for public comment. I'm sorry. This is still a discussion amongst the task force members. After this portion, we will be getting right to public comment.
And that would be before a vote, correct?
It will be, well, we'll see if there is a vote, but public comment is at the end of the meeting. before we adjourn? Okay,
Yeah,
Louise.
thank you. Go ahead, Luis.
Sure. So I want to thank all of the committee members and the committee staff for your work. I think this is a really outstanding and well thought set of recommendations. I would lean towards the first option with an amendment because I'm hoping that we can spend our last task force meeting not going over these recommendations again so much as talking about where do we go from here now that we have the recommendations. You know, what are we going to do to turn them into reality? So I think I won't make a motion yet because I want to see what other people say, but I think where I'm leaning is the first option with the addition maybe of a recommendation that we're also asking City Council to look at how can the full set of recommendations be looked at in next year's budget process and next year's roadmap process.
Okay, great. Thank you, Louise, for that suggestion.
This is Quincy. I'll +1 what Louise just said.
Thank you, Quincy. Good to hear you.
+2.
All right.
Rosalind, I wondered if there's an opportunity between now and the next meeting to highlight recommendations that do not require money per se. I mean, they will require work and staff, things that are more of an administrative nature or a policy nature that have to, you know, or length or, you know, policy, I guess is the best word. Yeah, that
great. Yeah.
So that the council would know, okay, we don't have to spend more money. We have staff to do this. We just have to agendize or whatever the process is.
Great suggestion, Dolores, and the staff. We've been talking about this already because we're preparing. Right now, we're scheduled to go to the City Council on December 6th. And so we've been talking about what we need to include in that council memo because we do want to share with them 87 recommendations, yes, but we do want to categorize them just like you mentioned, because not every recommendation needs money to get implemented. So we were thinking about looking at those recommendations where city departments already has a work plan item doing that. So it's like supporting something that a city department is already doing. So that's one bucket. So really no money necessarily needed, ongoing work, it's supporting, right? Another bucket, to your point, are policy items, right? Where the city council would have to consider either revising an existing policy or coming up with a new policy. So we would put those in another bucket, right? And then we have, right, I think it's these 9 recommendations where right now currently we are suggesting that they would be funded through the $2 million, and we would talk about those as well. But yes, you're definitely on point that we would have to, you know, pretty much categorize the recommendations so the city council would have a better idea of where we're headed. And on top of that, you know, we anticipate that the city council will accept your report and recommendations. And then it's just the beginning for staff, right? Because staff is going to have to put together, right, a work plan around all of those recommendations and come up with, you know, how we start implementing, how we start reporting to the city council, how we keep the community informed, how we're going to do in terms of developing outcome metrics and how we share those. So a lot of work. Yeah.
Thank you. Thank you.
Carlos, you have to help me because I see lots of hands up, but I don't know who's next.
I believe David Lowe was the first, was the next one in line.
Thanks. Excuse me, sorry. I think the recommendations are great. I don't feel like I'd be ready to vote in those or whatever process we have in it. I do have kind of some questions about the funding. And this is the challenge of stuff, right? There's so much that needs to be funded with a limited amount of money. But I do wonder if there is one more step that should be taken, and maybe there's a steering committee, someone just look at these holistically, right? When I know from our committee, we just kind of looked at the amount of money that was put in our housing bucket and said, what should we do with it? But I feel like there may be some group or subset of this you should look at all together and say, is this breakdown between the different categories makes sense? Where is there overlap or not? And, you know, for all I know, if someone looks at it, we end up where we're at, but it would be helpful to have someone looking at that and come back to it before we finalize. And maybe that is something that we would talk about like at the next meeting, kind of like Louise mentioned, which I think is good. Like, where do we go from here? Because we know for implementing these recommendations, this funding is just kind of that first down payment. So if there's some way for that type of review or analysis or thinking to be done, and maybe Rosalind, if you guys at staff have already done that, then that'd be helpful to know. But I think that would be give me more confidence in saying that this is the best kind of funding allocation recommendations we can make with the 2 million we have available.
Yep. I think we can certainly agendize that for the steering committee that's coming up. Makes total sense. And then staff will continue to do our work on it as well.
I believe Ashley is next in line.
Great, thank you, Carlos. So I just want to clarify, are we selecting which option we would prefer right now? Is that what we're doing?
I think, yes, we're having discussion about how we get to a final vote on November 10th. And so right now, what I'm hearing is some consensus so far around option 1, where it's a vote just to accept these draft recommendations and funding allocations, and it goes to the steering committee meeting on the 26th for any further refinements needed. We just had the idea that the steering committee could look at the totality of the 9 recommendations that have been recommended for funding, just to get a better sense. So, yes.
Okay, thank you for clarifying. In that case, I would prefer the third option, which is no vote, and then further discussion at the October 26th steering committee meeting, and revising recommendations as needed, and then doing the final vote on November 10th.
Great, thank you, Ashley.
You're welcome.
Christine, I think you're next in line.
Great. Okay. Just to add to the discussion, if you will, just wanted to say that talking about the possibility of adding or changing policy in the city, that's a great idea. I would also like to think and say that at every level, at every stage, that a community-based group of advisors be put into the process at the beginning. Now, we've been doing a lot of work all of this time, and kudos to all of us. We've been working hard, fantastic, but it doesn't end here. And I'd like to make sure that it continues and on into the next fiscal year and so forth and so on. Thank you.
Thank you, Christine. I know that one of the goals of the Promotores pilot program is to continue to be listening to the community. It's one of their roles, one of their tasks of the Promotores is to continue to gather community input on what's working, what's not, and reporting back to the city. So, so yeah, I think I agree that they're continuing to get community feedback is important. Araceli.
Un poquito de lo que dijiste, Carlos. Iba a decir que estoy de acuerdo con Ashley. Yo también me iría por la tercera opción, porque sí me gustaría, estamos hablando de siempre incluir a la comunidad y agradezco por todo que estamos todas las organizaciones aquí, pero si estamos hablando ya de la penúltima reunión donde ya se va a tomar la decisión para presentarla a la ciudad, sí me gustaría antes de hacer la votación sobre las recomendaciones, el honrar si hay personas de la comunidad aquí en esta reunión, el poder escuchar su voz y el poder escuchar si ellos tienen algo que aportar a las recomendaciones y cómo tomarlos en cuenta también y seguir trabajando juntos. Por eso sí creo que es Yo me voy por la tercera opción también, igual que Ashley. Gracias.
Thank you, Araceli. Any other comments?
I would like to make a motion to accept option 3 for all the reasons stated. Plus, it will be really interesting to see the reorganization of the recommendations as you describe them, Russell. And I think it'll be fascinating to see that it will highlight some commonalities or needs. So if I may, if the committee would consider that motion.
Thank you, Dolores. Is there a second?
I'll second that. This is Rachel Monaco.
Thank you, Rachel. Louise, your hand is up. I'm sorry.
Yes. Dolores, I wonder if you would accept a friendly amendment to also make a recommendation to the City Council to consider how to incorporate the policy recommendations into the city roadmap and the funding recommendations into next year's budget consideration.
I think that's a great idea, Louise. Yes, thank you.
All right, so we have a motion and a second. And
Does the seconder have to agree to that too?
Yeah, I think we need a
That's true.
second on that, yeah.
On the amended motion,
I will stand by my seconding.
Rachel, you are in agreement to the amended motion. Okay.
Yes, thank you.
Thank you, Kira.
Any other discussion on the motion? All right, and I'm gonna be looking to staff because we've been tracking to make sure that we have a quorum for a vote. I believe that we do.
I believe we do, yes.
Thank you, Katarina. I see you shaking your head.
Great,
do we vote with the thumbs up? Is that okay? Or how do you want that?
yeah, so I think with the best is to use the reaction, the thumbs, the raise your hand to vote whether you agree with the motion. So let's go ahead and use that feature.
We're gonna go through number 1, number 2, and number 3, correct?
This is right now, the motion is to accept number 3 with the amendment of adding, asking City Council to incorporate some of the policy decisions into next year's city roadmap to consider that.
And that was with a thumbs up, right? Or not a hand?
So raise your hand. So
Raised hand function. Thank you.
Yeah.
Can we clarify next year? Is it next fiscal year or next calendar year?
So the city's next opportunity for roadmap consideration will be in Q1 of next year, but it would be for the 23-24 budget process. We currently have an already approved roadmap for 22-23.
So it would be fiscal year 24.
Fiscal year 23-24. Yeah, it would be for the next consideration of changing or revising the existing roadmap. So we have an existing roadmap for fiscal year 22-23. And so early next year, council will consider any changes to the roadmap for fiscal year 23-24. Yeah.
Got it.
Yep.
That's good. Thank you.
Sure.
Clarification. So
yes, go ahead.
If that's the case, isn't the expected rollout of what we're proposing supposed to be January 2023?
So Christine, when you say roll out, so certainly, right? So again, We assume that the City Council in December will accept the task force report and recommendations, direct staff to develop a work plan, probably around these category of recommendations, and then to start implementation. So to your point, they will be some recommendations we don't have to wait, like we can move on them immediately, and we'll work to do that.
Okay, the non-monetary is what you're saying, then we can move on faster than we can move on the monetary.
Right, except for the 2 million that's allocated, that's existing money. That budgeted money is in fiscal years 22-23, so we could start on those recommendations right away.
Thank you.
Sure.
And Rosalind, I see we have, I believe, 22 hands up. So 22.
Great.
Okay, now we had 23 for a quick second.
22 or 23?
22. Okay, 23. Any, just raise your hand. So we have 23.
You have 23. Okay, in favor. All right.
Yeah, and so let's have everyone lower their hands. All right, so I see still 3 hands up, Matt, Victoria, and Quincy. Just want to make sure we can get those hands down so we can go ahead and get, I guess, a no vote on option number 3 with the amendment. So,
anyone opposed to the motion? Yeah. If you could raise your hand. We see none. Are there any abstentions? Anyone abstaining, not voting?
all right.
Okay.
So I think we do have a vote for accepting option number 3 with the amendment.
Great, thank you. Thank you so much for doing that. We appreciate that. All right, so we will be gearing up for the October 26th steering committee. At that meeting, we'll categorize the 87 recommendations into different buckets, and we'll be determining how we name those, and we will get those out before that meeting date. All right.
So we're at the public comment portion of this the meeting tonight. If we do have members of the public who wish to speak, go ahead and simply raise your hand, and we can go ahead and call it. All right. Don't see any hands up. Last call. We have no public comment for tonight, it looks like.
Okay. Gabriel, I just want to make sure you had your hand raised earlier for public comment. Okay, guess we're good.
Yeah, no, actually, there's no need to make comment. You already decided something. So usually public comment goes before you guys decide something. So I guess our comments don't matter, so it's cool.
Okay. All right, so we're going to turn next steps over to Rob Lloyd.
Yes, so as Rosalind shared right at the start, we're in the home stretch with the final meetings rounding. The steering committee will provide the final recommendations and the funding allocations that's consistent with the vote on option 3 we just took and the 87 recommendations then. The last task force meeting, just for a reference, and Rosalind mentioned this earlier, we're going to have the data and budgeting committee present, and this $2 million is actually the last piece of over $800 million of federal, state, and city investment in COVID. related community actions. And we're also going to share the work that the committees have done to refine and finalize the impact measures of their recommendations and how they tie together. Then how that's going to connect with the work with city departments to weave those impact measures and the recommendations into the city's long-term work and decisions. So the Data and Budgeting Committee is going to have a good amount of work to do. But then we have the December 6th presentation to council. There's going to be a memo as well as the final forwarding of what's decided. I think I can invite you on behalf of everyone that we'd love to see as many people there for that council meeting, because it is a lot of good work, and we are so grateful for all the time and effort that you've invested. And then the very last thing is we have the contact information here of staff. So if you need anything from us as we make this final turn, we're all here to support you. Rosalind, Aurelia, Carlos, anything you want to add, or Katerina, anything you want to add on that?
Nothing to add. You did a great job wrapping this up, Rob.
It's dinner time.
Again, thank you so much for your participation this evening. We really do appreciate it. And we hope to see many of you at the steering committee meeting on October 26th.